Welcome to my presentation titled Injury Prevention and the National Center for Medical Rehabilitation Research Disablement Model. My name is Ashley Crossway. I'm a doctorate and athletic training student at Indiana State University. The objective of this presentation is to demonstrate the interconnectedness of the disablement model, risk factors, injury prevention, and health-related quality of life. Disablement models provide a schematic to address the multi-factors that influence disability. An injury or disease has consequences beyond the level of the person injured. Additionally, disablement models provide a framework for conducting outcomes research, which will enable evidence-based practice with a focus on athletic training for this presentation. This presentation will focus specifically on the National Center for Medical Rehabilitation Research. However, it is important to note that there are other disablement models. To begin, we will review the National Center for Medical Rehabilitation Research model. In the schematic, you will see the 5 dimensions of the model with a corresponding level of disablement. Below that, there is a patient scenario with a lateral ankle sprain to demonstrate clinical applicability. The first dimension is pathophysiology, and the level of impairment is the cellular level. This would be a grade 3 ATF sprain, for example. The second dimension is impairment, and this has to deal with the whole body as a system. An example would be the decreased strength associated with the grade 3 ATF sprain. The third dimension is functional limitation, and this is addressing the whole body, so the inability to jump. The fourth dimension is disability, and this has to deal with a person's relation to a player losing their starting role. The final dimension is societal limitations, and the corresponding level of disablement is barriers, so this would be a loss of scholarship. Now I'm going to break down risk factors and prevention methods into 3 basic levels: the body itself, the person as a whole, and finally a person in their social context. So for the body, we're going to be focusing on the pathophysiology and impairment dimensions of the disablement model. Risk factors are biological, environmental, social, physical, or behavioral characteristics associated with health conditions. They are commonly classified as modifiable or non-modifiable. At the body level, modifiable risk factors include nutrition, pharmaceuticals. Non-modifiable risk factors include previous history and other disease. Specifically to the case I presented, neuromuscular control and foot pronation are 2 very specific risk factors for this individual. Moving on to prevention. Prevention is essential to mitigate the risk factors' interaction in the disabling process. There are 3 types of prevention. Primary prevention focuses on healthy people trying to avoid the onset of a pathology or disease. Secondary prevention focuses on the early detection and treatment of an asymptomatic disease or pathology. And then tertiary focuses on reducing the progression of a condition and to limit the additional amount of impairment. In the dimension of the body, we will be focusing on prevention through health promotion, including nutrition, immunizations, prophylactic pharmaceuticals, surgical intervention, and prehabilitation. A specific example relating back to our grade 3 ATF sprain is a proprioceptive balance board program as described by Verhagen in 2004. And now if we move up to the whole person, we'll be looking at the functional limitation dimension of the disablement model. Modifiable risk factors here include weight, body composition, behavioral characteristics such as attitude and coping, and skill level. Non-modifiable risk factors are gender, age, height, race, genetics, and anatomy. In terms of prevention, there's preventative rehabilitation, similarly to the proprioceptive balance board program that I just talked about previously. General exercise programs, health promotion, mental training, including coping mechanisms, orthotics, and braces. Relating back to our grade 3 ankle sprain, insoles or braces such as active ankles specifically would help prevent ankle sprains in our case. Finally, looking at a whole person in the social context, we are looking at the disability and social limitations of the disablement model. Modifiable risk factors here include field and court conditions, weather, rules, coaching, and equipment conditions. And non-modifiable risk factors include external personal behaviors and attitudes, such as those of referees, fans, or opponents, and playing situations. Relating back to our ankle sprain scenario, footwear conditions and the condition of the court are 2 risk factors that would help mitigate injury. Prevention here includes education, rule enforcement, and scheduling. The final component of our schematic is the health-related quality of life. This is the state of complete physical, mental, emotional, social, environmental, and spiritual health, not just in the absence of a disease. This is heavily influenced by a person's experiences, beliefs, expectations, and perceptions. And two common examples of health-related quality of life questionnaires are the short form 12 or the short form 36. Disablement models change the perception of disability away from the focus of the physical impairment towards the interaction between the person and the environment in conjunction with the pathology or impairment. Addressing risk factors and implementing prevention strategies allow for more control or decreased risk of injury, thus resulting in a higher health-related quality of life. This holistic approach to healthcare will lead to better patient outcomes and establishing athletic training as an allied medical profession in the eyes of others. Again, here is a schematic demonstrating the interconnectedness of the disablement model, risk factors, prevention, and health-related quality of life. Thank you for watching my presentation, and here are my references.